Okay, hello. My name is Leo Krivsky. I'm one of the senior anesthetic consultants doing thoracics. We are what they call now perioperative physicians now, so we're going to be meeting you both before, during, and after the surgery. Although during the surgery, probably you won't see us very much, I hope. Your journey will start in pre-assessment clinic, where we see you and explain what's going to happen. You probably first have seen the surgeon before seeing us, so you have an idea what is going to happen from the surgical point of view. Although what we find, patients by the time they see us in the clinic, they are overwhelmed with information. Certainly what I find in my pre-assessment clinic, and so I see my job primarily being to explain you what is going to happen to you on the day of surgery, and I'm quite open, as well as all of my colleagues, to answer any questions about that, in addition to the technicalities of the anesthetic management, which is quite technical, and we spend quite a lot of time explaining what's going to happen on the day. We're open to any questions, and I start any conversation with making sure that you have any questions and addressing your particular concerns first before proceeding with my explanations. So after seeing you in the clinic, we then see you on the day, and it might not be necessarily the person who's seeing you in the clinic. We are quite a tight group of 12 people who specialize in thoracic anesthesia, and you see one of us. Again, we normally come and see you briefly before the surgery, introduce ourselves, making sure that all your questions are answered, and again explain briefly what's going to happen to you. We then see you in theater, and that's a very brief meeting. You probably will feel a cannula going in, and then the drugs, and that's it. We'll see you after the surgery. That's how it happens for you. For us, it's slightly more complicated. There's quite a lot of things to do when you're asleep. Lung surgery is different from any other surgery. We have to collapse your lung, so the surgeon can operate on it. They can't operate on lung that moves all the time, so we use special equipment and special tubes that go into your windpipe when you're asleep, and that allows us to isolate the lungs and then reinflate it at the end. And it's it sounds quite complicated, but it's a very routine procedure nowadays. It used to be very big adventure maybe 40 or 50 years ago, when people were still learning about how to survive on one lung for several hours. Now it's routine, and it's very safe. So we're looking after you during the surgery, wake you up, you go to recovery, stay there for a couple of hours, depends on the procedure that you're going to have, and we make sure that your pain relief is sorted, that you're stable, awake enough, and fit to go back to the ward. I would say 90+% of the patients go back to the ward. It's a specialist ward. I'm sure the nurses will explain to you all the technicalities about your recovery, but it remains our responsibility as well. So as I said, there are 3 stages of your journey. It's a preoperative assessment and explanations, then the surgery itself, managing your physiology and the anesthetic itself, and then the post-operative recovery. That's also our responsibility, and we plan it very tightly to make sure that you recover well. But it's also a very active process. It requires quite a lot of effort on your side to make sure that the lung that's been collapsed for quite some time gets expanded, and you don't get any complications like pneumonias, which used to be quite common. So, you know, we are with you during your journey, and we're quite happy to answer any questions and to make sure that you understand what's happening. We're always available, and happy to see you when the time comes. Thank you.